Here is an instructional video on how to replace a wire that's popped out of one of the back brackets. Now commonly it's in the first wire where the wire is very small and it can move out of the bracket easily. It can also happen in a more rectangular shaped wire. You can see it's got a bit more body to it in the light aligning wires. By the time we get to our steel wires, if the wire's popped out, then there's a bit more of a bigger problem that's more difficult to solve from home. But in the first two wires, particularly in the wire that it happens most commonly, the small round wire, it's easy enough to pop back in at home. Now what's caused the wire to pop out is a bit of food has hit the wire, bent it down, bowed it down, and you can see the end of that wire there. It's bowed down to the point where it's popped out. So that's what the food has done to the wire. Now, most of the time, the wire, temporarily, you can grab the wire and just, even the child, your patient yourself can just tuck it in there underneath that hook, which will just buy you a bit of time getting the wire out of the way so it's not digging into the cheek. Now, getting that wire back in place is just simply a matter of grabbing our wire and feeding into, if you see at the back of the mouth, there's a little hollow tube that runs the length of that back bracket. So we need to get that wire back into that tube. Now the wire's very springy. That's the idea of it. It's trying to get those teeth straight. We need to bend it down and feed it into that tube. Now, what pliers or what instruments have you got at home to do this? Now, we've got specialized pliers. If you have a look at the ends of the pliers, it's relatively fine. A bit of a kink on the end of the plier certainly helps. My favorite plier is this one here. It's a small plier, probably more like a jewelry sort of making plier. Certainly, I think probably if you went to the more expensive pliers you can buy at Bunnings, you'll be able to find something similar. I guess look at what you've got. It doesn't have to be a kink in there. You can get a straight plier, but it depends on how wide the mouth or how flexible the lips are getting around the back of the mouth. Some people are very tight as far as the cheeks, and it's difficult to get at the back, which means a curved plier will be better. If you're stretchy, you've got stretchy lips, well then a straight one might work as well. Now tweezers, that's a very common thing to have at home. Tweezers are difficult to do this because it doesn't grab the wire and doesn't give you control of the angle of the wire. So you certainly can try with tweezers. You can see how it keeps letting go. You've got to bend it down, and you can see I've got no 3D control of that wire because it just keeps popping out of the way. So that's where tweezers are really difficult to get it in the right spot. So if we grab a set of pliers, I'll come the correct direction, so you're coming from the front of the mouth. You need to grab the wire and you grab it towards the end of the wire like so. We can now bend this wire. Now this wire is super flexible, so we can pop it down like that. You can see the bowing of the wire between the teeth. We bow it down, find the end of the wire, find the entrance to that tube. I'll try and show you that. Hang on, let's grab the end of the wire a bit further down. Entrance to the tube, if you can see that there. Feed that wire into that tube. And you can see I've got to jiggle a bit to get the right spot. Now there's a wire that's popped down and hasn't quite got in. If you leave it like that, it's like a spring between the teeth, and that's going to end up making those teeth sore. So we want to grab the wire, lift and feed it into that tube. Think of it as a straight line there. The end of the wire has to feed into that straight line through the center of the tube. So we feed it in like so to get the wire back in place. Now sometimes that can be difficult to do, and in a bigger wire that's going to be more challenging to get the wire bent into the right spot. So sometimes what we'll do, and there's a separate instructional video on how to replace this O-ring. You can watch that instructional video. So we can put I talked about using a sewing needle, something that's reasonably robust. The pin is too small, something like a sewing needle to get underneath that O-ring, push down, and we're going towards the tip of the tooth, not towards the gum, because otherwise you might slip and get the gum. So then we lift, and you can hear it click off two halves of the bracket, then off the other two halves of the bracket. And what we've now revealed is a longer span of wire. This makes it easier to bow that wire down, get it back into that back bracket. Like so, feed it in there. You can see I need something like a plier to actually bend that in to get it into the tube. And now we place the wire into the tube and into the center of the bracket directly in front of the tube. We can now replace that O-ring, or we can tie some floss around that O-ring, and we'll do a separate video to show you how to use floss to replace an O-ring. Thank you.